Victoria's mental health crisis. Let's have a look. Hello everyone, Florian.heise here, and welcome to another episode of HeiseSays. Grab your stein of coffee, because I'd like to look at a rather depressing article from news.com.au, which I think draws attention to the mental health crisis that is growing in Victoria. Now, before we go through this, I encourage you all to reach out to people that you know, simply just to talk to them, to let them, to just give them some human contact. Some people could be quite isolated down there. Some people could be quite afraid. My sister-in-law, she has a friend from Victoria who's a bit of a hypochondriac, so she's having a lot of problem dealing with this. And she's, contacting her and speaking to her. They're guildies in a online game, so that's how they know each other. And this poor girl is having trouble dealing with it. Since her mother works in frontline, she's been too scared to even hug her mother for months. You can see how that can cause some mental health issues. And she's thankful that she has, her mate in the guild to talk to communicate with on a daily basis, so people can get through it. I encourage you to reach out to people that you know, because this is concerning, and this is part of the price that we're paying to mitigate this virus and to reduce the spread of it. Now the question is this worth it? Has this been taken into account when we're discussing the economic implications as well? It's another part to it, guys. So let's have a look at this. A new national suicide and self-harm monitoring system shows the impact of coronavirus in Australia. New figures show many Victorians aren't coping with the impact of the coronavirus, with an increase in ambulance visits for one concerning behaviour. And this is quite worrying. This is why I encourage you to reach out to people. You don't know, maybe just a chat can be enough to help them. New figures show there was a significant increase in self-harming behaviour in Victoria this year as the state grappled with its response to the coronavirus. The Australian Institute of Health and Welfare, together with the National Mental Health Commission, has today launched a website that provides more timely monitoring of suicide and self-harm data. And we'll have a look at that website in a minute. And it's got... Well, my understanding was that they would not release this information for fear of causing copycats. That was the fear. Previously, it would take up to 18 months for the statistics to be released, and experts have criticised the lack of real-time monitoring. However, it hoped the National Suicide and Self-Harm Monitoring System website will soon see monthly reports available for each state, with many already providing regular data. Because we've seen all the anecdotal reports and Twitter and things sharing, particularly people working in the ambulance, the AMBOs, just how many call-outs they're doing. The World First system includes information on ambulance attendance for suicide attempts, suicidal ideation, self-injury, and mental health. The monitoring of suicide in particular has taken on a sense of urgency, with experts warning that lockdowns required to control the... See, this is the thing. They're saying it's required to control it. There's differing opinions on that, but still. As well as huge job losses could lead to an increase in cases. Yes, this is part of the price that we're paying, everyone. This is part of the price that we're paying. Is it worth it? While figures so far don't appear to show a surge in suicide, which is good, hopefully that remains, there has been a noticeable increase in self-injury in Victoria. Self-injury can include behaviours such as cutting, burning, or hitting oneself with or without the intention of dying. It is often a response to distress, with some people finding that physical pain provides temporary relief from emotional pain. Data available for the first time as part of the establishment of the National Ambulance Survey System shows the ambulance attendance related to self-injury between January and June in Victoria were up 17.6% compared with 2019. The AIHW spokeswoman told news.com.au there were 2,106 ambulance call-outs in 2020 for self-injury incidents compared to 1,719 in 2019. Previous self-harm is a strong risk factor for suicide, so monitoring of intentional self-harm is seen as a key to suicide prevention. A review by the Australian Bureau of Statistics of reports and coronial findings found a personal history of self-harm was the most common risk factor associated with suicide. It was reported in 17.8 cases of death by suicides for men and 30.9% of deaths by suicide for women. Even prior to the pandemic, rates of self-harm in Victoria were higher than in other states that had provided the data. Why is that? In 2019, the rate of self-injury among Victorians was estimated to be 18.3%, 18.3 per 100,000 people. In New South Wales, it was 17.2. In Tasmania, it was 12.5. Only the ACT was higher at 27. Why is the ACT so high? Women generally have higher rates of hospitalization from intentional self-harm than men, although men have higher rates of suicide. The ambulance data showed a 13% increase in mental health attendance, which is consistent with the greater use of mental health services seen in other data. This highlights the fact that greater use of and need for mental health services does not necessarily equate to trends in the number of suicide attempts, the website said. The vast bulk of people who use mental health services will never have a suicide attempt, but timely access to mental health services could reduce the number of deaths by suicide. The NASS is a partnership between Turning Point, Monash University Eastern Health Victoria, and the jurisdictional ambulance service across Australia. So COVID is linked to suicide. In more positive news, ambulance attendances linked to suicide attempts in Victoria were similar to figures in 2018 and 2019. In fact, the total number of ambulance attendances for suicide attempts between January and June was 2% lower than the same period in 2019. Attendance for suicidality, thinking about suicide, was 4% higher in 2020, but also fairly similar across the 2 years. While the website currently only includes 2019 ambulance data for Victoria, Tasmania, and the ACT, as well as data for the fourth quarter of the year for the New South Wales, it's hoped that monthly data for all jurisdictions will be made available from mid-2021. However, coronavirus seems to have been a factor in at least 28 suspected suicides this year. Data on suspected suicides in 2020 has been released for both Victoria and Queensland as part of the Suicide Register project. This data is from coroners located in each state as opposed to ambulance data, and final figures may vary as investigations take place. Australia is one of the few OECD countries to release this data, with New Zealand being the only other jurisdiction to do so. So far, the statistics published as part of these registers don't show an increase in Victoria or Queensland in deaths but COVID-19 did appear to contribute to 28 suspected suicides in Queensland. So is this just what's tipping some people over the edge? Data from 2020 IQSR found that police officers mentioned the coronavirus in 32 of 454 suspected suicides up until January 31 this year. In 4 of these cases, it was unclear if COVID-19 contributed to the suspected suicide, but 28 appeared to be linked to the pandemic. It is believed that in 14 of these people, the coronavirus may have impacted the suspected suicide through affecting mood, coping, stress, and anxiety. Another 11 were impacted through employment, 8 due to social isolation, 5 due to changes in access to healthcare support and items, 1 due to relationship breakdown, and 1 due to finances. The result points to the value of support offered to people who say the pandemic has impacted their mental health, employment, social connections, relationship, access to healthcare, and finances. Suicide registers currently exist in Victoria, Queensland, Tasmania, and Western Australia. New South Wales is aiming to have a register established by October 2020, while the AIHW is working with South Australia, the ACT, and Northern Territory on establishing registers. So, rise in use of crisis lines. The use of crisis lines and mental health services has also increased since the start of the pandemic, with calls to Lifeline between August 10 and September 6 up by 15.3% compared to the same period in 2019. Contacts to Beyond Blue, including calls, web chats, and emails, were up 38.6%, and contact to Kids Helpline were up 24.5%. The use of crisis lines in Victoria in particular have risen compared to other states. There's also been an increase in the use of Medicare subsidized mental health services. In Victoria, there was a 20% increase in people using the services in the 4 weeks to September 6 compared to the same period in 2019. Across Australia, the use of these services was up 12.5%. 1/3 of these services was provided through telehealth. The statistics support the view of psychologists who have previously told news.com.au that demand for their services have increased. So, preventing suicide. It is hoped the information provided to the new website will support governments, services and communities to better respond to suicide and self-harm. This brings together the most comprehensive collection of data to date for suicide deaths and self-harm across 8 states and territories in a single web-based, interactive and integrated platform, AIHW Deputy Chief Executive Officer Matthew James said. The NMHC Chief Executive Officer Christine Morgan said preventing suicide and suicidal behaviour was a key priority in Australia. Every life lost to suicide is one too many, she said. We can all take action to prevent suicide with some understanding of who is at risk with simple steps. This new national system and the representation of the data will help facilitate public conversation about suicide, self-harm and suicide ideation, potentially saving lives. So if you're in trouble, call Lifeline on 131114 or Beyond Blue on 1300 22 4636, Kids Helpline on 1800 55 1800, or Headspace on 1800 650 890. And I think calls to have more discussion on this are quite noble, because it really is tragic when people see that as the exit and the solution to their problems. And if we can jump here, we can see the website. I mean, you've got the latest update here, and you can have access to the data, research and information. Like approximately 3,000 deaths by suicide occur every year in Australia. The highest proportion of deaths by suicide occur during midlife. More than half of all deaths by suicide in 2018 occur in people aged 30 to 59, compared with 23% of those aged 15 to 29 and 21% for those aged over 60. That's the risk, guys. Midlife crisis. Using linked data, the estimated suicide risk is higher among those with fewer years of education. Early indications from ambulance data in 2019 suggest females are more likely to attempt suicide than males. But men are 3 to 4 times more likely to take their own life than females. Women are more likely to attempt it. Men are more likely to succeed. So guys, I'll link to this website. I encourage you to reach out to people. If you're in trouble, get some help, guys. Make a phone call. It can't hurt. You know, just do it. Talk to someone about it. Because, you know, this isn't the solution. As always, thank you for watching. Please like, share, and subscribe to the channel. If you're a fan and want to support the content I make here, there are a few ways you can. Join the channel on YouTube or Patreon. Support us using our affiliate links at Amazon, eBay, Independent Reserve, or Kucoin. Buy our merch from HeiseSays, use Gold Pass from the Perth Mint, or support us via PayPal. Take care, guys, and take care of yourself.